ففروا إلى الله إني لكم منه نذير مبين ولا تجعلوا مع الله إلها آخر إني لكم منه نذير مبين.
Assalamu alaikum. I'm here to talk about depression. As we all know, depression is a mental health illnesses that people shy away from because they believe they will say, me, what's depression? Me, I'm just sad though. There's nothing wrong with me. But the truth of the matter is, it's better to understand what depression is so that if you have a family member, friends or colleagues that have such disorders, you can refer them to the specialist to help in making them feel better with themselves. Some people will say depression, everybody has depression. This is not true. If you use depression as an English word, you can say that's okay, I'm depressed. But if you say I'm depressed, it's different from saying I have depression as a diagnosis. So I'm depressed means I have a low mood, I'm not just interested in something. But saying that you have depression means that you have some areas of symptoms. And these areas of symptoms must have been persistent in that person for more than 2 weeks. And it would have been disturbing that individual place of work, how the person communicates with people and family members. So these are the symptoms that one should look out for if one says you have depression. The person will have low mood in that the person will just be down and it will be persistent. Secondly, the person would have loss of interest in the things they do normally. Maybe someone that loves to read Quran every day, somebody that loves to watch ball at their leisure for our men. But you just find out that you just don't have the interest in doing those things you enjoy doing. Maybe it's even someone that loves to cook, as in that's the happy place of that person when the person is in the kitchen. Or you just find out that the person is not even interested in doing anything. The person just wants to be by herself. You don't want to do anything. You're not interested in anything. And thirdly, the person just don't have energy to do anything. The person will find out that you are just in bed all day. You are not standing up to go and do your normal daily activity, the things you love to do. So these 3 things are the major symptoms of depression that can make someone say someone has a depressive disorder. And if these things are persistent for 2 weeks, non-stop, that is definitely a disorder. And there are other symptoms that they call minor symptoms. They call, the person has loss of interest, no concentration, that person cannot even concentrate on anything. And there's poor sleep. Poor sleep can be the person cannot even initiate sleeping, or the person when they initiate sleep, they wake up earlier than normal. By the time they wake up, they cannot find themselves sleeping back again. And also there's loss of appetite. You just find out that that person is not eating well. So even the way people even know that this person had something is wrong with this person, the person will just have lost weight. If you are not sleeping well, you are not eating well, there's no way you will look healthy, even within yourself. There would have been loss of weight. Apart from that, there's even the fact that there's loss of libido. You just married couple, you just find out that you are not just interested in sex. Your husband will you are not even asking for it. Maybe your husband will want to. You just tell the person, please, just leave me. Let me be by myself. These are signs of depression. You don't have the interest in having a sexual relationship with your husband. You are depriving him of what he's entitled to. But it's not your fault. You're actually depressed. It's not as if you are doing it intentionally. So if you see these symptoms in anyone, somebody is complaining about these small symptoms to you, you understand that this person is actually depressed and not using the word literally, I am depressed. But if these major symptoms and minor symptoms are there, this person is actually depressed. Aside that, there are also the person will feel worthless with herself, feeling hopeless, that there's no hope in this world. And there will now be, at the end of the day, there can be symptoms of suicide when it is not very, very long-standing. The person will be suicidal. You feel that it's even better to just end this all so that I'll stop feeling this way. Is it not better to take my life and stop having this uncontrollable feelings that I am having? So these are the common symptoms that people will have when they say they are depressed. Is depression hereditary? Yes, it can be hereditary, yes, because there's something, we'll say there's genetic load. There's a family history of depression, means that generation, it can skip generation, no doubt, but there's a family history of depression. There's likelihood that somebody else can be depressed. It can be generational. Maybe this generation is skipped, the next generation, but it can be hereditary. But can depression occur without even having a cause? Yes, it can just occur without you identifying this is the reason why I am having this thing. And also there are some people that be the way they stress, they respond to stressors. So having a stressful life event can even lead someone to having depression. These are some risk factors, like loss of a job, loss of a loved one, maybe a spouse, a family member, an auntie, somebody that is very close to one. If this occurs, it's a risk factor that can lead to depression. Also, losing one's job, and like I always tell my patients that even Nigeria itself is stressful. So the fact that you are even in Nigeria, you are under stress. So how do you manage your stress is very important. So as not to even lead to something else for yourself. So these are the common things that can cause depression. Can depression be, there are some, we can say people that are prone to having depression. Both sexes, a male, a female, children are depressed these days. Children can be depressed, yes. And female, but in the adolescents, that is in the adulthood, we say it's more commoner in the female. But it's not as if it is not common in the male. It's commoner in the female, but it is also common in the male. But this can occur, and it is better to be able to speak out, talk to people, so that you can seek help. Aside that, our children too, the normal symptoms that I explain now that can occur in people, it's not the children will not be able to exhibit depression in the common symptoms that the adults will exhibit it. Their symptoms cannot be frank because they cannot express themselves. But our children, can they be depressed? Yes, they can be depressed. Can they be suicidal? Yes. Even now, studies have even said that suicide is even common in our youth. So these are common things that we need to look out for. So what else can cause this depression? Use of substances. And substance abuses is now common in our teenagers. So this thing we need to advocate and tell our adolescents to abstain from use of substances. Substances, hundreds of alcohol is a substance, is even a gateway to use of other substances. Cannabis is even readily available. So these things are very worrisome. They are worrisome, but it is what it is. We need to teach our youth that they should abstain from doing all those things. Cocaine, everything is out there. You can get it easily. And this thing also can lead to depression. Medical illnesses itself, somebody having a chronic illnesses, like someone having been diagnosed of having cancer, someone being diagnosed of having hypertension and is long-standing, somebody that is on medication, this too can make the person to be worried. And when you are worried, it can also lead to depression. Depression is that you worry too much, you are not sleeping, you are not eating well, you now stop enjoying the things you love to do, like I've earlier stated. These things can lead to depression. So it's not just because you have a particular illness. That is why depression can occur in anybody. It's anybody that has a brain can have depression. So, and if someone says he or she has depression, you shouldn't be stigmatizing such an individual. What you should do is look for how that person will seek help. And is there help? Yes, there is help. There are professionals that treat these patients. Just seek the right people and you will get to be treated. What are the common ways to treat this kind of illnesses? Medication. There's no way you will not be medicated. When you go to the doctor, they will give you the medication, and it is even individualized. A medication can work for A and might not work for B, but it depends on the symptoms you bring forth to the doctor. The doctor will be able to tell you, okay, this medication should work for you depending on the symptoms you bring. Aside that, there's what we call psychotherapy sessions as well. Psychotherapy is, saying it in a layman's language, is talking therapy. Talking therapy is that when people say problem shared is half solved, when you talk to a therapist, when you open up and you're able to say the deep things that is worrying you, and you know that this therapy has your best interest at hand, it's not as if this person is going to divulge this information to anybody. You'll feel at peace. You'll feel at peace with yourself. You'll be able to, okay, this is what I'm going through, this is what is happening, and with the help of the therapy and with your medication, the therapy will help you to be able to move from, okay, this can be the cause, this might not be the cause, okay, it might be at this point in time that you had this these symptoms, this was what made you to be depressed. Identifying the cause is very important, because if you're not able to identify what is causing you to having depression, how can you even treat it in the first instance? So identifying the cause is very important. Once the cause is identified, you medicate and you progress through helping this person. Because if the cause is not identified, no matter as much medication you give, this person might not even get well, because you've not been able to identify, okay, this is the reason. Like somebody that lost his job, somebody that lost a loved one. Help the person to accept the loss. Help the person to navigate through the loss. Help the person to have a closure that this person has gone. All these things will help the person to understand that, oh, this thing was what made me to feel this way. And the person will be able to push him or herself out there and be able to understand that, oh, depression is actually real. It is not that it is a disease of the weak. You saying now, oh, you are depressed, it's because you are weak. It is not so. It can happen to anybody, like I've earlier said. Depression can occur in anybody that has a brain. So it's not somebody that is weak that can say, okay, you are weak, that is why you have depression. No. I, as a person, I can have depression because I have brain, and there are some common comorbidities. Somebody that has depression can have anxiety. Somebody that has anxiety can have depression. So it is best to be able to identify these are the common disorders that can coexist with each other. And if you have anxiety, that anxiety means you are not sleeping, you start being worried, you'll be afraid of doing things. These things are treatable. Yes, seek help, seek the professional help. And once you seek this professional help, I believe you, you will seek the proper treatment that you require. And like I had earlier said, medication and psychotherapy is the gold standard treatment of treating someone with depression. And I pray once you identify any individual that has it, talk to them, tell them that they can talk to you. A problem shared is half solved. Don't let if you see a friend that you have not heard from, call that person, reach out to your friend, reach out to your loved ones. They might be having problem that they are not just able, they don't know who to talk to, they don't know the right channel to go through. But if you check up on them and you let them understand that I am here for you, if you need help, I can direct you to the right person. So this is doable. So my parting word is that if you have anyone that has depression, it is not a cause. It is not because the person is weak. It is a mental illness that needs treatment.
آمنت بالله وملائكته وكتبه ورسله واليوم الآخر والقدر خيره وشره من الله والبعث بعد الموت لا إله إلا الله آمنت بالله وملائكته وكتبه ورسله واليوم